Mr. Speaker, today I rise to express my opposition to the GOP health care bill. On Monday, we received from the CBO a report that the House repeal bill will increase the number of uninsured Americans by 24 million in 2026. 52 million Americans will be uninsured in 2026, which is more than ever before, and definitely more than the Affordable Care Act. The intentions here are clear. The bill's drafters are choosing to ration care for the elderly and working class to fund tax cuts for the nation's highest earners. Under the GOP bill, a 64-year-old with an income of $26,000 will have to pay a net of $12,900 more each year for her coverage than she currently does. In addition to the disproportionate harm that this bill will do to seniors, it will also accelerate the insolvency of the Medicare Trust Fund by 3 years. Mr. Speaker, the GOP plan cuts $880 billion from the projected Medicaid spending over the next decade, while providing almost $600 billion in tax cuts to the wealthy and to corporations. 64% of the tax cuts would go to millionaires and billionaires, while additional 20% will go to those making between $500,000 and $1 million. Mr. Speaker, less than 1% of my constituents make more than $200,000. So it would be irresponsible of me not to voice my concern for a bill that contradicts the interests of my constituents so blatantly. When I first got a copy of the bill less than 2 days before we marked it up in the Ways and Means Committee, I was left wondering if the bill was written to address our nation's health care challenges or just to relieve the wealthy few from their tax obligations. The drafters of the bill made the disappointing choice to favor value-tested and failed trickle-down economics over investing in stronger, healthier America. Large numbers of unhealthy and uninsured Americans are not reflective of the governing bodies that make good choices. The Republican health plan directly slashes funding for people with disabilities by $12 billion, cutting the program that helps people live in their communities and reach their full potential. I represent a historically underserved constituency in Alabama's 7th Congressional District. The median income in my district is less than $34,000. The majority of the health providers in my district have a patient population that is disproportionately dependent on Medicare, Medicaid, and uninsured. These health care providers cannot withstand caps to Medicaid or increases in their uninsured population. If this bill is implemented without substantial changes, rural health care will be lost, and rural lives will be at risk. In my district, I've met constituents who have weekly made choices between whether to buy medicine or to put food on the table. I have a pediatrician in my district in Birmingham who will stop what she's doing to track down patients with newly infected STDs from being transmitted. In states with so many high rates of STDs in this country, every attempt to curb the spread of disease is critical. The GOP bill guts the Prevention and Public Health Care Fund, which helps community doctors provide preventive care and reduce public health crises. Mr. Speaker, over the past several weeks, my office has received over 600 emails from constituents about health care. Many shared positive stories about the Affordable Care Act. Others, particularly those from low-income areas, fall in that gap, that Medicaid gap. And the state of Alabama, like so many Republican-led states, did not choose to expand Medicaid. Unfortunately, the GOP health bill is not the answer. This bill will take Medicaid away from America's children, working parents, and seniors in nursing homes. By 2026, nearly 30% of America's age 50 to 64 earning $30,000 will be uninsured. Surely, Mr. Speaker, this is not what this body intended. This bill is not only morally unsound, but fiscally irresponsible. And I urge my colleagues to vote no for the GOP repeal bill.